Hey, happy, beautiful, amazing day. Dr. Bob Rakowski here with a coronavirus science update, fact update. This is the World Health Organization's assigned lead researcher, Dr. Bruce Aylward. He has a real powerful resume in terms of understanding epidemics and viruses and immunology. And so first thing I want to share, what he said was that across China, about 80% of these cases are actually mild, not 14% severe, and 6% become critically ill. So what happens when we have a bunch of really real mild cases? Well, guess what? A bunch of them are going to go undetected. And in fact, that's what it says here. If everybody knew who had it, it wouldn't be spreading like this. So let's compare the corona, essentially infectiveness, its spreadability to some of the other things that are out there. So MERS was the least on this chart, followed by the standard flu, followed by Ebola. So then we've got our coronavirus, which is less than SARS, and then mumps, rubella, measles, smallpox, things like that. So if you think about the Ebola breakout, and I'll show you a graphic on that, this one's somewhere between that and where SARS was. So we start looking at what's going on out there in terms of the spreadability. So this first graph that's really flattened out, that's China. And that's what things do. They level off over time. Italy, they're saying it's a little early to figure out if it's leveling off just yet, but it appears to be. Iran is leveling off. South Korea is leveling off. United States, they show that one leveling off. Japan, much slower rise. Singapore, for whatever reason. So not sure about what's going on with the populations there. So one thing that we may want to do is really just keep to ourselves for a period of time. If you're not interacting with infected people, you're not going to get infected. If you yourself are a silent carrier, you're not going to infect others. So as we look at pandemics in perspective, I really thought this was pretty fascinating. I'm going to blow this up, but here's HIV and AIDS. This was the Spanish flu, which was the biggest one of the last decade. And then let's bring that a little bit closer. HIV, still a big problem. Fortunately, medically, they're managing it. We know how it spreads, so we can be more proactive. But then when we look at this coronavirus, it's just a tiny little dot, in terms of what's going on out there. So you start comparing it to other things like swine flu, for instance, even though that one's coming past, looked like that was a lot more significant. And again, certainly HIV, the biggest scourge of our modern day. Again, to put it in perspective, putting these things side by side, this is what this graph actually showed for this tiny little dot here is this new coronavirus. So when you start looking at really solid data from the CDC, that's where it's from. If we don't take factors to slow the rate of infection, then it peaks really fast and valleys really fast. I think we kind of see all that to a certain degree in China. Now, what happens if you slow the rate of infection? Well, I guess you would probably have more personnel and more care to take care of people that were critically ill. And of course, that would be really important. So, what's the bottom line on all this? Things level off. They always do. You should be part of the solution, not part of the problem. That's my advice. And how are you part of the solution? Be extra cautious to not infect others or infect yourself. Keep yourself healthy and happy, and let's share the good news around the globe. Let's not write this up as the next biggest thing that's going to kill every man, woman, child on planet Earth, because unfortunately this one's really harsh on people over 60, but doesn't seem to be anywhere near the problem for people that are under 60, and especially for pediatrics. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful.